Here's how to talk to your patients about neuropsychology.
There are many misconceptions about what a neuropsychologist does, and you may find it hard to describe what their services entail to your patients. Some patients may have never heard of a neuropsychologist and might confuse them with other healthcare professionals. Neuropsychologists train as scientist practitioners and specialize in brain-behavior relationships. They consider biological, psychological, and social factors of health and integrate this across assessment, therapy, and research. Here are some situations you may encounter in your general practice.
Well, Dr. GP, I sure am having a hard time these days, and I'm not really sure who I am anymore since I bumped my head.
Well, Jimmy, I'd like to refer you to go see a neuropsychologist.
I'd like that. I bet they could read my mind and guess what I was thinking. That'd be really neat.
Well, actually, neuropsychological assessments are usually conducted to determine your cognitive strengths and weaknesses, and this is done by reviewing your history, factoring in your symptoms and your concerns, and then using standardized testing instruments to look at different cognitive areas like memory and language.
Sounds a lot like talking to Sigmund Freud.
Well, not really. In fact, there'd be no leather couches, and you'd probably be seen in the hospital. How you doing these days, Dawn?
Wow. These days, Don can't even remember if he's had his afternoon cup of tea. He needs a brain scan.
I'm going to give him a referral for neuropsychology as well as neurology.
Will we get our brain scan that way? We need to see what's going on up in that potato head of his. Have you seen that thing?
Well, the neurologist may do a brain scan.
Why do we need to see this neuropsychologist fellow?
Neuropsychologists can help us understand the changes that are happening in Don's brain. They would conduct an assessment that measures his cognitive functioning through his observable behavior and responses to specific interviews and tests.
That sounds awfully subjective to me. We want an actual picture we can count on. Right, Don?
Yeah.
It's true that neuropsychologists use their clinical judgment to interpret tests, but they choose and use tests that are shown to be effective in rigorous research studies. I think a comprehensive neuropsychological assessment will help create a more complete picture of Don's brain.
Yeehaw!
Hi, Doc. Let's save the small talk and cut to the chase. We need more medication for Tommy. We've been dealing with it since we moved here, but now that he's a teenager, we just can't deal with his ADHD anymore. He's having angry outbursts, getting D's in school, drinking recklessly, and using drugs.
I think Tommy would benefit from seeing a neuropsychologist.
Will the neuropsychologist give us more meds to treat him?
No, neuropsychologists don't prescribe medication, but Tommy may benefit from the treatment a neuropsychologist could provide. Neuropsychologists have training in a variety of therapeutic orientations and a strong understanding of how cross-cultural differences and mental health symptoms interact with neurological symptoms. A neuropsychologist could assess Tommy's functioning and behavior in various domains and settings, formulate a treatment plan, determine behavioral strategies Tommy could implement in school and at home, help with medication adherence, and monitor his progress. That was really useful. Now I know how to better explain the services a neuropsychologist can provide.
Great!
Created using Powtoon.